Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Nobel Mahomva is here with me on the sign language. According to WHO, there has been a sharp increase in the total number of reported daily new COVID-19 cases globally. The majority of these cases have been reported in Europe and America. In the past week, South Africa, Morocco, Egypt, Ethiopia, and Nigeria were reported as the top 5 countries in the Africa region that recorded the highest burden of COVID-19, with South Africa accounting for about 41% of all the cases in the region. As of the 4th of November 2020, Zimbabwe had recorded a total of 8,427 PCR confirmed COVID-19 cases since the epidemic started, including 7,907 recoveries and 248 deaths. The highest number of confirmed cases has been recorded in the Harare Metropolitan Province, with a total of 3,327 cases and 121 deaths, followed by Bulawayo Metropolitan Province with 1,688 cases and 61 deaths. Public health measures, social measures as well, introduced at a very early stage of our epidemic, have contributed to the progress made so far. The need to continue adhering to these preventative measures is really critical if we are to end this pandemic. 2 weeks ago, I talked about results of a survey that showed that only 25% of Zimbabweans see themselves as being personally at risk for contracting COVID-19. I noted then that this very low risk perception was contributing to the observed low adherence to the recommended preventative measures in our communities. Today, I would therefore like to focus on a few frequently asked COVID-19 questions, issues, myths that are associated with this complacency we are currently experiencing in our communities. This fatigue or complacency, call it whatever you want, is threatening to derail our national response. We need to refocus and pay attention to the recommended COVID-19 preventative measures in order to avoid putting our hard-earned current progress in jeopardy. So the first myth is on COVID-19 virus transmission and the hot weather. During visits to various communities, including workplaces, some individuals have stated that transmission of COVID-19 is not going to take place anymore now that we are out of the cold weather and we are in this nice, beautiful, hot weather. This is not true. COVID-19 virus can be transmitted in any climate, hot, cold, or humid. The nice Zimbabwe hot summer season that we are currently enjoying does not prevent the spread of COVID-19. South Africa, our neighbor, has a similar hot climate like ours, but is currently recording the highest number of new cases in the Africa region. It is a good indication, a good sign that hot weather has not stopped the spread of COVID-19 there. It will not stop it here. The best way to protect ourselves, our communities against COVID-19 is to social distance, to frequently wash our hands with soap and running water, or frequently sanitize our hands with an alcohol-based sanitizer, and of course wear a mask that covers both your nose and your mouth. These measures, not hot weather, help stop COVID-19 virus transmission. COVID-19 virus infects and affects people of all ages. The disease is generally mild for children and young adults, yes. Most people recover from the disease without requiring special treatment in hospital. That's correct. However, the total number of COVID-19 deaths out of the total number of confirmed cases here in Zimbabwe is high at 2.9%. This proportion, also called case fatality rate, is high compared to that of other countries in the region, such as Mozambique at 0.72%, Uganda at 0.88%, Namibia at 1.02%. Our high case fatality rate confirms that COVID-19 is dangerous. It is a dangerous disease here in Zimbabwe. We need to take it seriously because it can kill you if you get it. Globally, over 95% of COVID-19 deaths occur in people that are 60 years and above. And Zimbabwe is no exception to this at all. The highest percentage of reported deaths in Zimbabwe has actually occurred in this age group. Elderly people and those who have underlying medical conditions such as diabetes, heart disease, the high blood pressures or hypertension, BP, people call it, respiratory diseases, they are actually among those who are at greatest or greater risk of dying from COVID-19. Another question that has been asked, does COVID-19 virus have a gender preference? Well, here in Zimbabwe, men account for 56% of all confirmed COVID-19 cases. Experience from across the globe indicates that men are more affected by COVID-19 than women. And several other studies have also shown that more men are dying from COVID-19 than women. Experts have indicated that this could be because women tend to have a stronger immune system than men. When you seek medical assistance, what medicines do you receive to be cured of COVID-19? This is another question that has come on. Well, currently, there are no licensed medicines to cure COVID-19. Severe to critical cases that are admitted to hospital in our intensive care units, for example, receive appropriate supportive treatment, including drugs or medicines that address their signs and symptoms, as well as medicines that are there to take care of their other medical conditions. If you have COVID-19 signs and symptoms, let me remind you, isolate at home, get tested, seek additional medical guidance or assistance from your health provider, the Ministry of Health and Childcare, for example, on the free hotline number 2019. This is very important. Which brings us to the next question. Should children also wear face masks? According to WHO, children 2 years old and below should not really wear face masks because it can compromise their breathing. Parents and guidance should therefore make sure that all the other preventative measures are in place and are being adhered to by your children. Zimbabwe's protocols on use of face masks by children are very much in line with the WHO recommendations. Finally, journalists have also asked many questions many times. One of their favorite these days is that, is Zimbabwe flattening the COVID-19 curve? Well, what exactly does flattening the COVID-19 curve mean? Flattening the curve is a public health strategy during an epidemic such as COVID-19, and it is aimed at slowing the spread of the epidemic or the spread of the virus. It means putting in place and adhering to recommended epidemic control measures so that the peak number of confirmed cases at a time is reduced. Reduction in confirmed cases ensures that the capacity of our healthcare system is not exceeded. In other words, it's not overwhelmed. Zimbabwe is very much on track in this area, though lots more still needs to be done because the epidemic is not over yet. Flattening the curve relies on how well communities are adhering to the recommended COVID-19 preventative measures, such as social distancing, proper wearing of face masks, frequently washing your hands with soap and running water, or frequently sanitizing your hands with an alcohol-based sanitizer. Those are the things that will help flatten our curve. It is critical that we continue to adhere to these recommended measures. Once again, do tune in to ZTV and other social media platforms, including the radio, for this weekly update. Your continued participation in this national response is vital.